So, folks, it's the $5 trillion question. Healthcare. We spend $5 trillion a year as a nation to get increasingly worse outcomes health wise. Healthcare is our life, it's our liberty, it's our prosperity, it's our economy, it's everything. And most of that 5 trillion is either directly or indirectly influenced or spent by various layers of government, the federal government leading the way on that. And we're in this vicious degenerative cycle like heroin. The more we spend, the more the insurance companies charge, the more we give them a monopoly, the more they can charge what they want to charge, the more we have to subsidize more. And it's not just creating healthcare inflation, but this is the biggest driver of the broader deficit and money printing engendered to facilitate that. And that's why everything else is expensive. And this is the message Republicans have failed to deliver. So right now, there is bad news and good news at the same time. The bad news is Democrats set this trap with taking everything insolvent about Obamacare over the last 10 years. And under Biden, they basically subsidize most people in the private market. You're right, it's unaffordable. So here, we're just going to write you a check or write a check to the insurance companies. Well, that didn't make it affordable. That just put us into debt and everyone's paying for it in essentially, the last 5 years, by my analysis, the average family of four has had to spend a cumulative 80,000 more to live. So that's where you're paying for it. But broadly speaking, if you're not getting subsidized, and even if you are, it really costs this, and if you're getting it from your employer, it's coming out of your salary. Between premiums and deductibles, it winds up being about $35,000, $34,000 per person. And now that the subsidies are expiring, Republicans have nowhere to run because you're going to get blamed for high prices no matter what you're in charge, even though none of them voted for Obamacare. So you could either repeal Obamacare and a lot of the other things that are making it that you have no choice in competition, why you don't have cheap catastrophic plans, and then the ability to spend the rest in the affordable sphere, the equivalent of the healthcare equivalent of your car analogy here, oil changes, gas, tire rotations, out of pocket. So maybe rather than spending $35,000 coming out of your pocket and or salary, you spend maybe a total of $10,000 a year. Instead, Republicans are pushing to extend the subsidies, but let's have a little less fraud. Not such a high income threshold level, but not repealing any of the aspects that are driving up the costs, thereby getting all of the political liabilities, not solving the problem. And this is the thing. Republicans are facing a wipeout no matter what. You can't do worse than they're doing now. For the amount of political capital that they're assuming and incurring in order to do milquetoast garbage, you may as well just repeal Obamacare and implement full healthcare reform, which I want to talk about today. And what better person to talk about with this than our good friend Reg Hislop. He is a healthcare regulatory compliance expert, economist, and has a lot of thoughts on this healthcare debate, as well as what the Federal Reserve did yesterday to juice up the stock market at the expense of Main Street once again. A must follow, by the way, on Twitter at H2 Health LLC, and he's with us in the flesh from his office. Hey, Reg, thanks so much for joining us once again here at The Blaze.
Daniel, thanks. My pleasure.
Okay, I want to get right into it. So this is classic uniparty. So Democrats want to just endlessly expand the grift, just subsidize healthcare insolvency and national inflationary insolvency. And Republicans have this Cassidy-Crapo plan that they're going to vote on, and a couple of similar ones being thrown out. I'm just picking that one. That would say, you know what, you're right. We shouldn't directly subsidize the insurance companies, but we'll just give handouts to people to afford the unaffordable things, but not really, because it will be basically $1,000 to $1,500 in HSA for plans that are crazy. Oh, but you have to purchase a bronze Obamacare plan that they're calling catastrophic, that honestly is more expensive than my more comprehensive pre-Obamacare plan.
Right.
What the heck is going on here?
First of all, what the heck is going on here is politics. It's not policy, it's politics. The difficulty we've got is Republicans and Democrats, more or less, have backed themselves into a corner by continuing to subsidize a broken system, so to speak, right? We're dealing with an environment in which the costs below, driven by years and years of horrific policy, government overreach, regulatory structures, and so on, have created the most inefficient government-dominated market, right next to green energy kind of stuff. So we've got this problem, and now we're looking at ways to kind of do, what I think Republicans would want you to believe is a Solomon sort of decision, right? We want to split the baby. We want to be able to basically use a wonderful talking point about this notion of creating sort of this consumer-oriented market. And the way we do that is we're going to give away money, which in fact doing that is just inflationary to begin with. And it really doesn't do anything in terms of lowering the cost of healthcare, because it can't. The costs are being driven by other policy. We're not going to lower anything. As a matter of fact, argumentatively, we may actually make it worse, not necessarily better, because we're going to trap people into pardon the expression, a crappy plan, give them an insufficient amount of dollars to actually do anything, and at the same time march merrily down the road with the same kind of flawed infrastructure and the same sort of structure that creates the problem. This doesn't make care cheaper. It only makes it more cumbersome. And again, giving away, government printing money to give to you doesn't necessarily do anything to change the healthcare paradigm that we're in, but it also does cost the government money it doesn't have. Remember, we're 38 trillion in the hole. Printing more money, whether you give it to the insurance companies or whether you give it to individuals, it's still kind of this ongoing government subsidy of a kind of a core level of inflation that makes absolutely no economic sense, and the healthcare policy is still bad.
No, exactly. And it's basically lukewarm hell. And there's no such thing as lukewarm hell in politics. Until now, I have always said we can't move on from Obamacare. You just can't, because it is the number one most expensive thing. And we will not be a free people if we don't repeal it. But they're like, now let's focus on immigration, do this, do that. I don't want to rock the boat. Well, now you're forced to, because now these things are going to expire. So basically, we have the government stabbed people with Obamacare. Then they came in, and just in the individual market, I want to get to the corporate plans, because the employer-based plans, that's a whole nother problem I want to get to in a minute. That's not being touched by this. We gave people morphine. So Republicans are just debating the levels and circumstances of the morphine administration, but not dealing with what is creating the pain to begin with. And my fear is that no matter what, this will be called Trump care. Now you're going to own it. Sure. No matter what, you're forced to own it. So you may as well actually do what's right. I want to get to what we should be doing, but I first want to talk about how this is harming businesses, because the subsidies, while inflationary, were shielding the costs for individuals, but still a lot of people get their plans from work. Describe what's happening on the employer plan front.
Sure. Employer plans, when you have a very, very inefficient system, which is what we have, employer plans need to go out into the marketplace and buy essentially covered services. They create plans based upon services that are available in the market. With the amount of regulatory dictates that are there, they really can't, other than by looking at kind of a structured, sort of self-funded, self-insured, hybrid kind of a plan, they really can't competitively work in the marketplace. Whenever you have something that overlays, like Obamacare, Medicare, all right, Medicaid, that makes the system very, very inefficient and actually consumes resources in and out of the system in a way that is not very cost effective. So Obamacare is loaded with subsidies. Those subsidies actually end up creating a different insured contract. Those contracts then, those insured contracts, have a spillover effect into the rest of the healthcare economy in which all prices rise, right? To pick up the inefficiencies, all prices in effect rise, making government sort of the biggest consumer, and then the private side, the employer side, to go out and compete in that market when that market is all, pardon the expression, boogered up by bad government policy, by Medicare, by Medicaid, by Obamacare. That employer plan really just simply becomes a conduit by which all other dollars flow through, and they flow through at the next highest increment every single year. Subsidize Obamacare. Fundamentally, those insurance companies then pass along any of the existing inefficiency back to the employer side. The employer plans become that much more expensive. Daniel, particularly on the small business side, so I work with a number of small businesses to create sort of consumer-driven contracts to partner in the private marketplace with primary care models, direct primary care and so on, which operates outside of, they're independent physicians who are saying, we're not going to do insurance. We're also then going to find other physicians and other labs and imaging centers and so on that will take a cash price and we'll work through that. Now, those are very difficult to set up kind of systems. And there's a lot of insurance companies and networks that won't work with them. They're hard to find TPAs for and so on. But the problem again is because health insurance continues to cost so much, small employers have two choices. One is to either continue to pass the cost on to the employees one of two ways: premium increases and or shared costs, which are deductibles, co-pays, all that other kind of stuff, right? Or opt out and force people into the Obamacare market. Here, I'm going to hand you $250. Go get your own health insurance. And I'm seeing more and more small employers do that because they cannot.
They can't afford it. I mean,
they can't get into an employer plan. There isn't one that's affordable for them.
Just to put numbers on this, since 2014, family premiums in the employer market have gone up 52%. The workers share 31%. Deductibles have surged 53%. So now we're reaching almost 18. And in 2024, it was almost $1,800 per month. I was told by my employer I would be earning $35,000 more. A lot of people don't realize that. They certainly are feeling their share of the contribution to the health plan is growing, and that's for sure. But it's the entirety of it, because they have X amount of money for payroll. So, okay, I mean, some of it they're paying for, but that means that you're not getting it in cash. I would much rather the pre-Obamacare system where, I could go out and purchase a catastrophic plan. Most years pay minimal amount out of pocket for the remainder of the stuff. Let's say spend $10,000 on healthcare, $8,000 on healthcare that year, and then get all that $35,000 in cash as part of salary. That's the vision we need to give. But so HSAs were meant for that model, not keeping the Obamacare model where you can't find affordable plans and then, here's $1,000 for your HSA.
Right. Realize if you look sort of at the data in terms of just take any political hat off and just look at where the numbers fall and look at the actual data. If you look at a single individual or a healthy couple, two, that don't have any major pre-existing conditions, and even if they did, let's say they have a little bit of blood pressure, they have a little bit of this, they have a little bit of that, right? Today, that couple will pay more for their employer coverage than it will actually utilize in any single year for the actual cost of care that they need in that year. It's the relationship is now inverted to the point where it costs you more to carry something that the only reason you're carrying it, for all intents and purposes, is for the catastrophic event.
Yep.
If that's the case, because the average American isn't utilizing that much care, even the average, look at my wife and I, neither of us are spring chickens. But at the same time, what we annually use in care doesn't come anywhere close to what our insurance premiums are and the cost shares and everything else. It's just not. I'd rather, as you say, give me the dough. I'll go into the market and buy what I need when I need it from a competitive panel of providers that are out there. And then, yeah, I'll insure the catastrophic. I can deal with that, but save me the other stuff and let me be a smart consumer. Not only am I much more likely to utilize care cost effectively, because again, I will access care that I need when I need it and pay for it, than I am to look at, which I see happen a lot with families, the deductibles high, the copays are high. So we defer utilization, right? That they shouldn't be deferring, because the cost of doing that is prohibitive, especially in an economy like today.
And they're blowing their wad on the premium. See, this is the problem.
Right.
Someone once asked me, I thought you were conservative and you like the cost sharing. Yeah, we do, when the premiums for catastrophic were as low as they were before Obamacare, and they should have been even lower because you had other government interventions. But the problem is what Republicans are calling catastrophic now, and they're using that term, but it's within the bronze confine of Obamacare. It's too high. People don't have the money once you're blowing that much on catastrophic. That's not, but it's like Cadillac. It's the price of a Cadillac premium pre-Obamacare. So then you don't have any money left. So then they're like, oh, we'll give you money. Even that's not enough, but it's just enough to be inflationary. And, it's ridiculous. So I want to get to solutions. I want to read. Well, no, one other thing, actually. I want you to go over the paperwork cost. So we all know that Obamacare created a scheme of actuarially insolvent insurance that made it that you can't have affordable insurance without government subsidies. And then that created a monopoly of just really 5 insurance companies or so. So we have no choice in competition. You have no tailor-made plans anymore. And that was done. People know about that. They know about the ban on physician-owned hospitals. That provision is a big problem, and that needs to be a part of anything. But isn't it also true, the forgotten aspect of Obamacare, that it created this paperwork structure, or this regulatory compliance structure, that was so cost prohibitive that those that lacked the economies of scale to deal with it essentially had to become part of the hospital system? And isn't that, in fact, Reg, why over the last 10 years we've had this generational consolidation of healthcare away from the individual physician into corporate medicine?
No question. I'll actually argue with you just a tad that Obamacare just exacerbated what was already a bureaucratic hellhole, driven by Medicare and Medicaid with nonsensical reams of paper, collecting data upon data that means absolutely nothing, that does nothing for care, that doesn't make any care provision better, faster, cheaper. But it's the government, asking reams and reams of questions and gyrations for providers, and then mandating over and over and over again the way you do it and how you do it. So you got 3 things that happened, and they continue to happen on an ongoing basis. The upper end of healthcare, the bloated end, if you ask me, the administrative end has just expanded exponentially. So you've got these positions that exist with all kinds of different titles: VP of Care Coordination, VP of HIMS, VP of this, VP of that, executive VP of this and that, and so on. And it's just this overarching bloat that these health systems have created to manage the bureaucracy that's below it. Doctors, providers, whether it's been podiatrists, not as bad, a lot of that's private, but physicians, all across the board, in order to basically cover the nut of their medical education costs, the debt they carry, etc., particularly on the primary care side, have looked at, I can't afford the infrastructure cost of operating a primary care practice with the paperwork, the support staff, the iterations of billing that I have to do, the reporting, the meaningful measures, and all this other kind of stuff. So they end up being essentially forced into a consolidation, either with a mega clinic or with a hospital, with a hospital organization. Now we have all kinds of fancy terms, MSOs and, physician hospital organizations and so on. But these are just docs who have effectively given up.
Yes.
And said, I can't practice independently. And the one who suffers in that, not only the doctor, because their satisfaction with the practice of medicine, falls through the floor, but the patient suffers. And the patient suffers greatly because they no longer have choice.
And then the quality also with the paper compliance, everything, they're just looking in front of an iPad the entire time. I mean, everyone knows
you're talking about, by various estimates, upwards of close to $1 trillion a year in just, throughout the U.S. health system in just compliance that's totally meaningless. That means absolutely nothing.
So obviously the solution is, number one, you have to take the pressure out. You need catastrophic. So I think I want to go down my list and then see what else you have on your list that I don't have mine. Number one is any plan before you get to HSA, that's second base. First base is you have to allow all insurers, employers, trade associations, states, anyone to offer unregulated alternatives, including expanding short-term plans that the first administration tried to do, but I haven't seen from them. You could offer any plan you want. Then once it's cheaper to buy catastrophic, then you could expand HSAs by raising the contribution cap to maybe, $12,000 per individual, $24,000 per user. But here's the key: allowing that to be used for premiums, concierge fees, health sharing ministries, and then allow employers the same tax exclusion they get if they take your compensation dollars and give it to United Health or Cigna, right? They get a tax. I mean, this literally, that was the original sin of healthcare, where government tethers healthcare to medical insurance and tethers medical insurance to place of employment, where you say, no, now you get the same treatment if you give people a donation to their HSA for health sharing ministry, for concierge, for direct primary care that you are working with. So equalize the tax treatment. Then obviously, price transparency, lifting the ban on physician-owned hospitals. What other things do you have in your bucket?
Well, so where you first started is like the most important key measure to effectuating broad-based change that would automatically be accretive to every consumer, really basically to every provider that's out there, which is to get rid of mandated benefits. Just basically, get the government out of mandating what must be covered and paid for, so that individuals could fundamentally work in a marketplace and decide what they wanted to buy. Do that and make that universal across every state. States can't change that. States can't mandate abortion coverage. They can't mandate, the mental health parity stuff, all the rest of this other stuff. Get out of that. Government out of that. That would automatically make the program make healthcare that much more efficient, and give consumers the ability to buy what they need and not have junk all over the place. The second thing, and I'm a big believer in this, and I know a number of other economists are too, price transparency. It works like you wouldn't believe in every other market. Why would we think consumers are stupid when it comes to healthcare? That the consumer's too stupid to understand.
They're not paying for it.
Right. That my MRI over here versus my MRI over there. In a hospital, it's 25,000. Down the street at Joe's Imaging Clinic, not that there's a Joe's Imaging Clinic, but you get my point. It's $600. If there's true price transparency, and it's one thing that I would say government can mandate, and it actually makes sense. Because everybody who's providing is participating fundamentally in Medicare and Medicaid. The private guys I don't worry about. True price transparency and no mandated benefits would be just a boon, like you wouldn't believe, to consumers, as well as not only improving care, access, but also reducing cost. There's a number of other things which just make logical sense. One is allowing physicians to actually, I don't know why we don't actually own hospitals. Physician wants to own a hospital, let them. Historically, we can show that physician engagement is better, not worse. Ending, place of care bias and payment bias. You realize a hospital outpatient department for, minor surgical procedure, let's say a skin cancer removal in a hospital outpatient department, is paid significantly more than in a physician's office.
So government uses what's supposed to be anti-poverty programs or Medicare for seniors as tools to steer those dollars.
Correct.
You're talking about the facility fees. Isn't there also another thing that we need with price transparency that you often have where physicians get locked in by these insurance companies where they have contracts that prohibit providers from offering discounts to self-pay patients?
Yes. Yeah. Most if you participate in the networks and so on, you are in this system where it's a complete utter bifurcation. And you hear this from the DPC guys, from the direct primary care guys and the gals that do this work, right? It's either or. You don't have a choice. If you're in, you must. And you have no control over the pricing, the duration of the service you provide, the number of you're in. If you're out, you can do whatever the heck you want. The risk you have is been the steerage, the network steerage that large systems do. And the physicians who play outside of it have to go and find their own base of patients. And fundamentally, the networks and the insurers and so on will actually steer away from the competitive side of the market. They'd rather overpay, and have patient access problems like crazy, in some of these systems. Can't even get in to see a dermatologist for 6 months for certain things. You can't get in to see kind of next level triage providers in these networks because they close the door and they fundamentally gatekeep like crazy. And the object is to steer and continue to manipulate the same kind of parameter inside of the system. The system doesn't want competition. It's too lucrative to not have competition.
In order to deal with that, don't we need to kind of repeal the HMO Act?
Yes. Yeah. And we also need to get rid of, CON laws and things like that, which fundamentally, again, benefit only providers that exist in that system. And they say, that the issue used to be, well, too much healthcare would make healthcare inefficient. Well, the reality is now it just becomes monopolistic.
It's a complete monopoly. It's a complete monopoly. And related to that, one of the things I hear a lot from our direct primary care, innovative, thoughtful doctors is this. They say that the government has created a choke point in residencies, that it's not so much the medical schools where there's a lack of spots, but a lack of residencies.
Correct.
And that somehow that is not natural and that is government induced. Are you familiar with that line of thought?
Yeah, I've heard it. I've not spent a lot of time in it, but we have it all across the board, medical education for physicians, but we also see it with schools of nursing. We've got a huge nursing shortage in this country. We got a huge provider shortage, whether it's pharmacists or therapists, physical occupational nurses, primary care particularly, and these programs are all choked down and heavily regulated so that there's very, very little opportunity for creativity to exist and to flow more providers through.
Yeah.
So the supply is fundamentally limited. We're also approaching this point, just this, and we could talk, this is almost another topic, but just the general demographic shift that's going in the United States right now. And I see it all the time. I see, we're getting the generation of doctors who were part of the baby boom, which was the largest creation of young people at a particular point who have been, since now matriculated to my stage in life. There's docs out there retiring left and right. There's no replacement for them right now. It's
not just quantitatively, but qualitatively.
Right. It's a 3-to-1 kind of a thing today. And that's going to accelerate. We're seeing it with nurses too. And the answer, Daniel, is not immigration. That's not the answer.
Yeah, you don't replace your population, but I know, there is a problem with the residencies. So these are the holistic things they need to do. To sum up, the point is that if they have this sort of vision and messaging, if anything, they'd be better off, certainly not worse off. And at a minimum, you would actually go towards solving the problem. But keeping the existing pre-Obamacare bad stuff, Obamacare bad stuff, just capping some of the Biden additional subsidies, it doesn't do anything. Real quick, relatedly, yesterday, the Federal Reserve Chairman, he gave a speech. He said that there's probably a net negative 20,000 in payrolls per month now. So that's the stag part of inflation. The prices we see still going up despite a terrible economy, which is pretty hard to accomplish. So they cut another 25 basis points down to, I guess, 3 3/4. And then they announced that they're going to begin $40 billion in monthly Treasury purchases. Could you explain what that is and what that causes?
Yeah, well, effectively, what they're doing is trying to keep the short end of the yield curve, fairly low and fluid. The reality is they're buying they're buying and replacing at the short end of the yield curve. Objectively, they're trying to keep liquidity in the economy. It is a function of the switch from quantitative tightening to quantitative easing. The bolster there is to continue to subsidize government spending at a level that is ridiculously high, and no one's addressing the elephant in the room. We've got, and you mentioned tariffs, and we won't go there right now. But we're creating $1.7 to $2 trillion a year every single year in additional debt. That money is funded through printing money, through the government essentially printing money. The buyers for that today, the primary buyers aside from foreign countries, is who? The Federal Reserve.
Well, where do they get the money from?
Right. Well, fundamentally, they have their own balance sheet and the ability to just simply acquire what they need on an asset basis and hold it and translate it through banks. They're getting it through bank deposits, paying much higher. They have been historically right now paying much higher on overnight deposits than banks were able to achieve through lending. Banks were then in turn to make margins, as we saw, were buying higher yielding securities and bonds and so on. As we've watched those yield curves shift, it's created some significant, couple of years ago, bank failures as a result of doing that. So the system is right now is churning to create liquidity to bolster and support spending on a government level. It's not flowing through to the private side at all in terms of actual increase in private capital especially for for small market economies and small business economies. The capital markets are brutal out there. The big guys don't need that. They're either getting, whole on government subsidies, the Mag 7, or they're getting it through Wall Street. They're equity companies.
So all this does, yesterday's moves, doesn't it in fact allow more capital to keep flowing to the same unnatural growth of the AI data center stuff that's already insolvent, and wouldn't be able to get off the ground if we had a neutral federal government and central bank, but we don't.
Right.
So that's all it does. So won't this just exacerbate the K-shaped dynamic?
Yeah. So you're basically weighing in, and you're having government make decisions around subsidizing certain sectors and saying, we're going to artificially flow money here. Whenever government has done that and put its thumb on the scale of investment, and manipulates a tough word, but it makes, it plays, right? Manipulates kind of the dynamics around a single industry. We have a group of industries. We've seen it with healthcare. We've seen it with pharma and the COVID stuff. We've seen it with green energy, et cetera.
Yep.
It never has a positive return such that the cost of the capital and the printing of money to go into it is actually fundamentally returned in an economic beneficial way. And the reason is government by itself is not a sufficient, or it's not a realistic competitor, because it makes choices and forecloses other options in that market.
Yep. Except if you own assets in that sector.
Hey, if you're in that sector, yeah. I mean, if you're, you can end up with green energy billionaires, instantaneously overnight for a product that never showed any real efficacy. Yeah.
And now we have the data center billionaires. And again, all of this debt, going back to what we started with, the biggest driver is healthcare.
Well, and the data center thing is, as you and I both know, okay, so it's being funded with a lot of short-term money, but the returns are actually much longer. They're 10, 15 years out.
Assuming it would show a return.
Assuming it does show a return. So you're effectively stepping into a negative equity or negative return position almost automatically from day one. If any of this plays out in a way that there is such an economic productivity return, and I know this gets real wonky real quick for folks, the objective for government spending to not be inflationary on the face is when it invests dollars into an environment where the economic return, the gain expressed through growth or change in GDP, is greater than the cost of the capital going in.
Exactly.
Okay. We're not there on AI. We're sure as heck not there on healthcare.
So basically what they did yesterday, we have this whole debate. No, government will not bail out. Yes, they will. And, OpenAI CFO writing a letter and asking, or, she mentioned it in an interview as one of their other executives wrote a letter to the White House Office of Technology asking for some sort of a backstop and loan guarantees. But in fact, what the Federal Reserve did yesterday without Congress is sort of a bailout.
Yeah. And, again, so you can look at a bailout as one of two ways, right? One is after the fact, the other's on the front end. So effectively, you may not call it a bailout, you may call it an incentive, you may call it an investment, and so on and so forth. But the reality is, it's the forced flow of capital away from the private sector.
Yep.
Away from a much more productive use, in my opinion, right now, which would be to curtail federal spending, and push it towards debt reduction or other economic activity that has a greater return, and allow the private sector to actually manifest its view of return on AI.
Yep.
And keep the government from artificially flowing dollars into that environment.
Yep.
Which again further constricts private capital.
The greatest example of this over the latter part of the 20th century was healthcare. Yeah. This is what government did, where it flowed all that capital to an entire insurance industry,
Sure.
making it not a backstop like auto insurance for a car, but making it the primary driver, consumer, owner of the entire medical care industry. So if you love your healthcare, you'll love our technology policy as well. Once again, misallocating resources. Man, I could talk to you forever. There's so much more economic stuff, but we've got to have a vision. It's do or die moment now. We may as well die on our hills, not on venture socialist hills that we are now at H2 Health LLC. By the way, I hope you open up a Substack one of these days to get some of your thoughts. We need to hear more from you.
Sure.
But give him a follow at H2 Health LLC on X. And thank you so much for joining us, Reg. And thank you all for listening. Till tomorrow, God bless you all.
My pleasure, Daniel. Thanks so